Hello, everyone. This is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Bright Spots Ventures. We bring leaders together to not only inform you, our audience, but also unearth these bright spots, these successes at health plans, hospitals, and other healthcare-related organizations. Our goal is to identify as many of these bright spots as possible so that you can determine if the ideas shared during each and every episode can be applied at your organization. We believe this approach of finding a bright spot and cloning it is the most effective way to improve healthcare in our lifetime. We have a special episode for you today where you're going to talk a little bit about bright spots and the opportunity to dig into bright spots at a in-person meeting that's happening in New York City. I'm going to get into that in a moment, but the name of the conference is Impact Health, not affiliated with Bright Spots in any way, but I want to introduce you to our two guests today because we're going to have a fun conversation about some of the hottest topics, some of the coolest things going on in our industry, and then tie it back to what this meeting in New York City in January is going to be all about and why maybe you should join me and our two guests, Shahid Shah, the chairperson for this conference, and Megan Antonelli, the CEO and founder of said conference, why you should meet all of us at this meeting in January. So, Megan, Shahid, welcome to the episode, and tell me a little bit about Impact Health.
Hi, Eric. Well, it is so great to be here. It's such a amazing thing for us to kind of connect. And I really have enjoyed, aligning with you and talking about kind of our history. But Health Impact is, it's my baby. We've been working on it and doing this event for, almost 15 years. It is we like to say it is the no BS platform for healthcare, where Shahid is our incredible MC and chair, and he really guides the conversation. It's highly interactive meeting with C-suite executives, really born, that 10 to 15 years ago of meaningful use of implementation, EHR implementation. And now, of course, really about implementing healthcare and technology at every point, particularly the patient-facing points.
Yeah, and Eric, this is really going to be an enjoyable conversation because the way that you, especially the way you introduced yourself and how your audience already knows you about these bright spots, that's what Megan and I try to do in person. So we take basically this kind of format and say, okay, what happens if we get together with 100, 200, 300 leaders who are actually doing the work, put them on stage, assume that everyone already knows what they're doing, right? The idea that somehow we're going to teach somebody what telehealth means or what an EHR is the height of insanity today, right? Everybody knows what's available in general, but what we don't know is what the heck is working and what is not working. And the way that you describe bright spots, I mean, that's just perfect, right? Because bright spots means there's a lot of stuff that ain't working, but wherever it is, let's go copy it and let's go clone it. So I think it's going to be a fantastic conversation.
Yeah, and I know you do two conferences. You do one in the spring in June and one in the winter in January. So before we get into January, which I'm excited to hear about, tell all of us some of the takeaways from the June conference so it could sort of whet our appetite a bit.
Yeah, so the way to think about what we saw in June was it was at the height of the conversation of AI, basically trying to transform the world and everything is going to change. But reality hits. And as people walk into the rooms and we're all talking about it, everybody realizes that things like AI or even the idea of telehealth, et cetera, there's a lot more discussion than there is about action. So what comes out of Health Impact in general, and what we definitely saw in June was, one, there's a lot more discussion going on about the day-to-day operational nature of tech support, meaning somebody can't log into their portal. Somebody can't access their medical images. The records are not getting back and forth, even though EHRs are in 92 to 98% of facilities. The connectivity is still a problem in the sense of the patients with the physicians at the periphery. So getting outside of a health system, still problematic. There's big discussion about retail clinics and how that was going to be the future of everything. But it turns out that lots of big companies are exiting retail clinics. So what hospitals were nervous about 3 or 4 years ago in terms of, hey, the retail clinic's going to take our jobs and put us out of business. Nobody's worried about that in any real sense anymore because everyone realizes it's really, really hard. And another area that Megan did a really good job getting everyone to really talk about was what is going on with the workforce, because the workforce has now taken on a much bigger discussion than pure technology, because technology in general should have started to disappear by now in the sense that it's being used on a daily basis. But it turns out that the workforce was not trained up to use the technology as much as we thought that they were. So there's a lot of discussion about how we're hiring. What is the retention plan? How do you pay people so that they stay at your hospital instead of another one? So lots of big, huge topics that really are tangentially related to technology and are enabled by technology, but didn't necessarily drive the conversations. And that's what we really love. So the format that Megan puts together is really cool, especially for somebody like me. I have a lot of knowledge about the industry and weaving topics together. But it really doesn't help if you don't have the smartest people in the room. And what's really cool is that our assumption, in fact, when I start the conference in the day is, we assume everyone knows what they're doing. That's not why they're here. They're not here to be taught to didactically. So we have a very famous no BS, no PowerPoint rule. Like there are no PowerPoint presentations allowed. Why? Because we want the conversation to have the emergence of the bright spots, as you like to say, Eric. And so workforce, retail, where are the technologies not working as well as we thought they would? Those were the 2 or 3 big things that came out of June. Megan, did I miss anything?
No, I think that was a great summary. I think a lot of the sort of hype cycle around AI has been, discussed. And so what was so exciting to see was what people were really doing, where they were really finding value. And, I think there were some surprises. I think that, the sort of certainly on clinical scribes, that there was, they were embracing it. Both the physicians, the patients, everyone was excited to see what the value that was going to bring. And I'd say that if I had to say that was the one technology walked away with thinking, all right, this has legs, that would be it. I think because, I always think you've got to have, if your technology satisfies one master, it's not going to work. It's got to satisfy, 2 of the 3 of the 4 legs of healthcare, right? Whether it's the patient, the provider, pharma, the plan, and this really does it for multiple, and it was the reception was enthusiastic.
Yeah. And if I could just add, Eric, one more thing, tacking on to what Megan is saying, this is what happens at events that doesn't really happen naturally in a 1-on-2 or 2-on-3 type of podcast or video or the things that we learn in books and things. And that is, once people get into a room and the excitement starts to heighten, then people start to say, yeah, I know I'm not really reading that much about my scribe, but that's the thing that really has done, wonders for us over the last few months. And so what happens on our side is, as journalists, we like to cover what we think is most important. And if we've heard that the things like Megan was saying, that scribes have been covered for years, we won't cover it again, even though that's really where our audience wants us to go. So when you put leaders like a CIO or a CTO or a CEO on stage, and everybody else in the audience is also a CIO, a CTO, a CEO, a CFO, a senior leader, a director, then they start to question each other. Why did you do this? Why did you not do that? And it goes beyond what they're reading in the rags, as it were, or what they're seeing on video into the reality. Because we actually live in 2 different planes of existence here. Those of us that are doing podcasts, those of us that, call ourselves thought leaders, if we're not daily, like you spent, Eric, so many years in the thick of things, you're not just covering it from the outside, right? You are in there daily, talking to customers, knowing what's going on. And that's what happens at our events, is that once you get them in the room, they all start talking to each other. They forget what people are writing about, what videos are being created, what is thought leadership. They're talking about day-to-day problems. And that's what we want to, come out and emerge from Health Impact in the same way that you're doing with Bright Spots.
So let's transition then to the near future, January 22nd, 23rd, 2025, and this winter event. The way I've looked at the agenda, I see it kind of having four pillars around the content. One is this digital care anywhere theme, AI enablement, which is obviously an extension of the June event. And then you have mental health and women's health. And so I'm wondering, I'll start with you, Shahid, if you could share maybe a success story or example from one of your presenters who's scheduled to come to New York in January and talk about maybe some of these themes and how it's going to be translated into a meaningful impact or bright spot for the audience.
Yeah, so two key areas are going to be getting people up on stage to talk really about, and this is what I tend to try to do more is make the speakers super uncomfortable. Right, make them tell the truth as opposed to telling everybody what their normal story would be. So a lot of our speakers will generally obviously talk about what is their hospital, what's cool about them, et cetera. But then we got to get them into the very specific conversation of your care anywhere strategy, and your platform strategy is talking about wanting to make sure that patients and their caregivers are well aligned with this technology. Where is it not doing that, right? So as we start the conversations, we almost always start with what's the myth of what is working and what is not. So as we start the speakers conversation from the top of the day, they're usually starting with the CEO level at the height. And then we, as the day builds, go into operational and day-to-day kind of regular doctors, nurses, et cetera, working with each other. So in these very specific topics, one of the most important ones will end up being how people, like at the start of the day, we'll have Dr. Chelsea Clinton talking about where they're putting their money for the new emerging technologies and where is the money going on innovation. That's going to help set the stage to indicate to everybody in the audience, hey, this is where VCs, this is where money, this is where investors are going. And then subsequent to that, we're going to have CIOs, CEOs really being able to react to that and saying, why are you guys funding that when we really need this? Right? And that is what's really cool about it is we have no idea how everybody in the room is going to react. And our general rule, though, is since there's no PowerPoint and no BS, people are going to make the case. And then you have senior leaders in the audience that say, I agree with that, but I don't agree with that. And then that helps us then evaluate. And so we put the people on the stage. We don't tell them what the topics have to be other than from a framework perspective, like the 4 items you mentioned. But we start the day with a provocative one to say, this is where real money is being put in, and then pick up from there. Megan, you can talk about the afternoon and the next day sessions as well.
Yeah, Megan, I have a specific question for you because I love the framework for how this is all going to be set up and super excited to see it all in action. When you're thinking about, Megan, the Care Anywhere movement and AI in general, what is one particular presenter or presentation that is kind of scheduled that we could get particularly excited about as it relates to those topics?
Yeah, well, it's hard to pick just one, but we have, there's a couple panels really around the hospital at home movement, right? What they've done at Guthrie Clinic, what they've done, Terry Coots and some of her partners and what they've done there. So there's quite a few. I mean, also Best Buy is, coming to talk about their efforts and how they've supported health systems in that realm. So there's quite a bit. And I think it's a really exciting time in that, obviously there's been so much forward progress with the hospital at home and healthcare anywhere, care anywhere. But at the same time, of course, there's some uncertainty at the federal level in terms of whether or not those regulations will be renewed and that this movement will be continued to be funded and So there's a lot of, the timing of this could not be better in terms of figuring out how and what health systems should be doing, because the patients want it, but there's things that are literally in the way of hospitals delivering it, in terms of reimbursement funding and just general access. So, we've seen how the technology can work. We've seen that there's a positive impact, yet the obstacles aren't quite gone. So there's going to be a lot of discussion around that, and what health systems can do to continue to deliver care anywhere, even in the absence of support,
I like that. And Shahid, we've alluded to the format, and we've talked a little bit about maybe the difference between a live event and a virtual experience. But even when you're comparing, let's say, this conference to a conference that maybe a lot of the audience may be more familiar with, like a HIMSS or a Health, what makes this format and the Health Impact experience just different?
Yeah, perfect question. This is a big credit to Megan, because when I first introduced this idea to her, she thought I was nuts, right? But the idea is that if you assume everyone already knows what they're doing, you can be a lot more flexible in the format. So then famously, our format is as follows. We all have panels. Smart people are on the panel. Smart people are in the audience. But unlike every other panel, we start the questions first. So you do a quick introduction. So let's say you're talking to a panelist of 4 CIOs. Basically, I'll just say, all right, guys, we have a topic in mind. So let's talk, for example, if it's about long-term care in the community, and the 4 CIOs are all dealing with long-term care, we'll say, okay, just introduce yourselves and your institutions. But then instead of spending 45 minutes of the panelists yammering on with each other and then 3 minutes for questions at the end, our